So thanks for the opportunity to speak today about the future of psoriasis care. I'm Manpreet, one of the dermatology registrars at the St John's Institute of Dermatology, and I'm currently undertaking a research fellowship focusing on psoriasis. So really delighted to share our work exploring ways to predict who will develop severe psoriasis and how this could improve psoriasis care in the future. So, as I'm sure many of you already know, psoriasis is a common skin condition that exists on a spectrum and affects people in different ways. For some, their psoriasis is mild and they might have good days and bad days, whilst others experience severe psoriasis, which can develop gradually or quickly. Now, 10 to 30% of people with psoriasis have severe disease, and this can have a huge impact on health in multiple ways. For example, having severe psoriasis can increase the burden of other health problems, such as heart disease, mental health issues, and directly impacts day-to-day life, from work to sleep, which we've heard about earlier in the webinar, to social interactions. Currently, when someone first develops psoriasis, we don't know what course their psoriasis will take over their lifetime. But imagine if we did. Wouldn't it be fantastic if there was a way to predict who was at risk of getting severe disease so we could take action early and give the right treatment to the right person at the right time? A more proactive and personalised approach. So there's exciting evidence from other medical conditions like rheumatoid arthritis, which affects your joints, and inflammatory bowel disease, which affects the gut, that demonstrates early action with the right treatment can improve the course of disease. And now we want to apply this approach to psoriasis as well. So to do so, we want to better understand why people develop severe psoriasis in the first place. And we're focusing on two main areas. So our genetic code and the environment. So let's start with the genetics. We already know a lot about the importance of genetics in psoriasis, but what is your genetic code? So our genetic code, or DNA, as you might have heard, will vary from person to person, and it's what makes us all individual. It carries valuable information about your family history, your ancestry, and your health. For example, in psoriasis, we know there's a strong family link. You might have a family member who's affected by psoriasis, and if you do, you're more likely to be affected by it too. And that's because you share parts of your genetic code. So what do we know about the genetic code in patients with psoriasis? Well, there are some medical conditions that are caused by changes in maybe one or two genes. However, psoriasis and other common medical conditions, like heart disease, for example, are caused by small changes across many genes. The combined effect of adding all of these small changes across these many genes together can determine your risk for developing a certain condition, such as psoriasis, and that's known as your polygenic risk score. So poly, which means many, genic, which refers to genes, and risk score, so to calculate the risk of developing a condition. Knowing your risk of developing a condition can be a really powerful tool to help lead a healthier life. Our team performed the largest genetic study in over 40,000 patients with psoriasis, and the findings are soon to be published, so watch this space. We developed a polygenic risk score specifically for psoriasis. The main finding from our study was that a psoriasis-specific polygenic risk score, so combining all the many genes involved in psoriasis, can predict the severity of psoriasis at a level similar to other environmental factors, really highlighting how critical your genetic code is. Alongside your genetic code, the environment also has a really important role in psoriasis, as I'm sure most of you know as well. So to better understand this, we launched the MySkin study. It's a UK-wide online platform launched in 2023 that allows people with psoriasis to report their experience. Among the MySkin community of 848 participants, so 62% of them are females, the average age is around 50 years old, and 86% have plaque psoriasis. We looked and identified common triggers for psoriasis onset and flares. So looking at psoriasis onset, the most common triggers were stress, infection, and skin injury, and these might be things that you can relate to too. For psoriasis flares, the most common triggers were stress, climate, and low mood. And again, these might be things that you've experienced as well. Lifestyle factors such as alcohol, smoking, and weight were also reported by our MySkin community. Ultimately, both the environment and our genetic code influences the development of severe psoriasis. And our goal is to understand this further, to really unpick the relationship between all of these factors so we can better predict who will develop severe disease. And so what could the future of psoriasis care look like? Well, through our research, we hope to build on this information to develop personalized and proactive tools to predict those who are at risk of severe psoriasis. And this is what the pathway could look like. So imagine a patient with psoriasis first presents in the community. Then, using a clever calculated tool, we're able to combine the clinical, lifestyle, and genetic information to predict the risk for severe disease. So finally, the third step that, for those who are deemed high risk, we can take action early, connecting them with the appropriate dermatology services so they can start the right treatment at the right time. Now, there are a number of steps that we need to take before we can reach this point, but it's an exciting prospect that could shift psoriasis care towards a more proactive approach. We're really excited to work closely with the psoriasis community to guide the development of these prediction tools and ultimately improve the lives of people with psoriasis. And we would love you to join us on this journey. We're actively recruiting patients to join the MySkin community to help us understand psoriasis better together. You can sign up. Sorry, I'll just go back to my last slide. You can sign up on the website address here, and we're also currently developing a mobile app, which is the exciting next stage of the study. So please do join us, and there's a QR code on the screen too. Thanks very much.